Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy, where we will be mainly focusing on ventral anterior body cavity. If you remember, in our last session, we talked about the dorsal cavity and its subtype like cranial and spinal cavity. Now we are going to continue the session but with ventral cavity, where we will talk about thoracic cavity, abdominal cavity, abdominal pelvic cavity and pelvic cavity, which is nothing but a name to the both cavities. Clear? So we will proceed in the same way. Like firstly, I'll walk you through some of the definition, important pointers that will help you to answer the questions in interviews and exam. We will also see some of the examples related to these terms. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Because for time being, we are just mainly focusing on what is ventral anterior body cavity. But prior to that, you should know what is dorsal cavity, what is other types of terminology that we have already covered, right? Like anterior, posterior, lateral, right? Superior, inferior. So these things you should know at least. And for that, you can also refer the Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions freely available in both Hindi as well as English language. So without any language barrier, you can consume the content. And in case if you want to ask any questions related to that, please let me know in the comment section. Alright, so as we have so many topics to discuss here, so let's go through this session quickly. So we have ventral cavity. Okay, so let's see the definition. The ventral cavity, body cavity, is located on the anterior front side of the body, and it is the larger of the two body cavities. Unlike the dorsal cavity, the ventral cavity is divided into two main sections by the diaphragm, a dome-shaped muscle breathing. Okay, so what three major points we learned from this? Like it's the largest body cavity, okay, out of two, like dorsal and ventral. Ventral is larger one. Okay, second, here the ventral cavity is divided into two major section or main section by the diaphragm. Now what is diaphragm? A dome-shaped muscle of breathing. Okay, so you can say that it divides it into two parts: the thoracic cavity, which is above the diaphragm, and the abdominopelvic cavity, which is below the diaphragm. Clear? Fine. Now let's see one by one. So firstly, we will start with the thoracic cavity. A thoracic cavity is superior portion of the ventral body cavity located in the chest region above the diaphragm. Okay. Now what are the boundaries of it? Superior, the opening at the top of the rib cage. Inferior, the diaphragm. Anterior, the sternum and costal cartilage. Posterior, the thoracic vertebrae. Lateral, the ribs and intercostal muscle. The thoracic cavity is divided into three main compartments. The first is right pleural cavity. So this is how it will subcategorize, right? Firstly, we are in thoracic cavity, then it has three types. The right pleural cavity contains the right lung lined by the pleura, a double layered membrane which is visceral pleura. Inner layer directly covers the lung surface. Parietal pleura, outer layer, lines by the chest wall. Between these two layers is the pleural space, which contains a small amount of pleural fluid that lubricate the lung during the breathing. Okay, so that fluid is needed. Now there are two terms that we should know, which is pleural effusion, abnormal accumulation of the fluid in the pleural space, and pneumothorax, abnormal accumulation of air in the pleural space called the lung collapse. So these are the two terms that we should know. Now the second subcategory is left pleural cavity. Subcategory of what? Subcategory of thoracic. Okay. So left pleural cavity is almost same, but it is for the left lung. So contains the left lung, same structure as the right pleural cavity. The line by the visceral and parietal pleural with the pleural fluid in the between. The left pleural cavity is slightly smaller than the right one because it contains the heart, some of the left side of the chest. Then we have mediastinum. that is a central compartment of the thoracic cavity located between the two pleural cavities. It extends from the sternum anteriorly and vertebral column posteriorly. It extends from the superior thoracic aperture, top of the chest, down to the diaphragm. Now these are the mediastinum contains like heart, trachea, esophagus, blood vessels, thymus gland, lymph node, nerves. So these all comes under a mediastinum contain. Now the pericardial cavity located within the mediastinum contains the heart lined by the pericardium, a double layered membrane which is visceral pericardium. Epicardium inner layer directly covers the heart surface. Then we have parietal pericardium, outer layer forms the outer sac around the heart. Third is like between these two layers is the pericardial space, contain the small amount of fluid, pericardial fluid that lubricates the heart during the beating. Fine. So I think this part is clear. Now there are two terms related to that: pericardial effusion, which is nothing but a abnormal accumulation of fluid in the pericardial space. Second is cardiac tamponade, a life threatening compression of the heart due to the large pericardial effusion. Now till here we covered all the things related to the first type, that is thoracic cavity. Now we will talk about the abdominopelvic cavity. So the abdominopelvic cavity is inferior portion of the ventral body cavity located below the diaphragm, and it is the largest cavity in the human body. So sometime it could be your interview question: what is the largest body cavity in the human body? Okay, so abdominopelvic cavity is divided into two regions mainly: abdominal cavity, which is the upper and larger portion of the abdominal cavity; superior, the diaphragm; inferior, imaginary line at the level of pelvic brim; anterior, the abdominal muscle; posterior, the lumbar vertebrae posterior abdominal muscle; lateral, the abdominal muscle or flanks. Now you might be thinking like, what are the organs that it contains? So mainly it contains stomach, small intestine, large intestine, liver, gallbladder, spleen, pancreas, kidneys, adrenal glands and ureterus. Second type is pelvic cavity, the lower and smaller portion of the abdominopelvic cavity located within the bony pelvis. So boundaries are: superior, the pelvic brim, which is a pelvic inlet; inferior, the pelvic floor muscle, which is pelvic diaphragm; anterior, the pubic bones and pubic symphysis. Now we have anterior, the pubic bones and pubic symphysis; posterior, the sacrum and coccyx; and lateral, the iliac bones and obturator internus muscle. If we talk about the organs, so it contains urinary bladder, rectum, distal urethra; in females it is uterus, ovaries, fallopian tubes, vagina; and in males it's prostate gland, seminal vesicle and vas deferens. So here is one important thing: the abdominal and pelvic cavities are continuous with each other. There is no physical wall or muscle separating them. The division between them is an imaginary line at the pelvic brim. This is why they are often referred together as a abdominopelvic cavity. Clear? So I think this part is clear to all of you. Now there is one question for everyone, and today's question is: what are like cranial cavities formed by how many bones? Okay, so it's a bit tricky question, but I'm sure you already know the answer because we already discussed this in our last session. So you just need to think about that answer and just share your knowledge and expertise in the comment section so that others can learn from your knowledge. Okay, and also in case if you don't know the answer, you can simply refer the last session that we covered, and from there you can learn this thing and then you can share your knowledge again. But make sure to share your question, make sure to share your answer, because it will also instruct me that you guys are learning from these sessions, and accordingly I will release the remaining session of this topic. Okay, so yeah, that's all for today, and see you in the next session with new topics. So thank you for watching. Take care.